This video has to do with how to activate your brain to help you with your pelvic floor dysfunction. Now, pelvic floor dysfunction could be incontinence, but not necessarily only incontinence. That's the subject of this video. Stay tuned. All right, so did you even have an idea that your posture plays such a huge role with the health of your pelvic floor? So if you have a dysfunction in the forms of many ways that pelvic floor can be presented by, not just incontinence. I've done a whole video on that. We're gonna put it at the end of this video. But one of the things that happens that accentuates the pelvic floor dysfunction, in other words, it's a feeder of the problem, is the poor posture, this slouching. So I've done a video on the difference between pelvic diaphragm and pelvic floor. So you can understand, if you watch that video, you can understand how your pelvic diaphragm needs to be parallel to the abdominal diaphragm. And when you're slouching, it no longer is parallel. So this is parallel. When you're slouching, the abdominal diaphragm goes down and the pelvic diaphragm, actually the front of it goes up, just like my hands are this way. So when that happens, there is actually more pressure from your breathing, and you're not even going down there, which you should. There's more pressure in the posterior aspect of you, in the back portion of you, and all of that even causes even more problems. I've done a whole video on the importance of posture with hemorrhoid. That's because that pressure in the back portion of you is even more. So now, the part over time, when you're in this position for so long, the part of your brain that says upright against gravity no longer gets to practice. So it starts actually shrinking. We refer to that as a digital dementia because it seems that these days, it's due to digital devices that encourage you to go this way. So dementia by definition is the shrinkage of the brain, so that's what that means. But so to activate it, just like any weak muscle, you activate it, you exercise it, it comes back, the strength comes back. Same is true with the brain. So to activate it, what you need to do is get in the practice of spreading your arms, looking up at the ceiling, for a count of 20, and then you let go. And then you do that again, count to 20, let go. And you do that 3 or 4 times, multiple times a day. Of course, that's not gonna solve the problem, but that kind of wakes up that portion of your brain called PMRF, pontomedullary reticular formation, which is about upright against gravity. There are other things that you're doing that are feeding that weakness that you need to stop doing. For example, your ergonomics, and of course your movement around, if they're causing any aches and pains that feed this posture, because this gives you more of a relief in those areas of pain, then they need to be addressed as well. But one of the things I always do is this, looking up. I call that praise the sun, that I made it up. You look up and do this for count of 20 and down, and that is a very good starter. And I want to bring to your attention that don't be all focusing on just the pelvic floor. You got to address the weakness, but you also need to address what's caused the weakness and what feeds that cause as well. This is how you holistically and in a very comprehensive manner, you address your problem. At any rate, if you like what you watch, please subscribe to the channel. If you have any questions, use one of the methods of contact in the description box to contact me. And until next time, take care.